Hello and welcome to Priced Out, a podcast where we talk about Maine's economy, past and present. Today's topic is childcare. Here to talk with us about that is Heather Marden, co-executive director of the nonprofit Maine Association of the Education of Young Children, and Laura Larsen, executive director of Family Focus in Brunswick. Thank you for joining us today, ladies.
Thank you for having us.
So can you tell us a little bit about your organizations and what services you offer?
Yeah, so my organization is called the Maine Association for the Education of Young Children. We're a statewide nonprofit, but we also are under an umbrella organization called the National Association for the Education of Young Children. We really focus on ages birth through 8. Our organization specifically is focused on a lot of early childhood education workforce issues. So we do advocacy and policy in the space, but also professional development training. We offer what we call a Teach Scholarship program that supports folks working in licensed childcare programs to achieve their higher education, with the ultimate goal that we're increasing quality and safety for children. Yeah.
Excellent. And Laura?
So we are a childcare agency in the Mid-Coast area. So we serve children from 6 weeks to 12 years old. We've been here 40 years this year. So we've been doing this 40 years in the area. Thank you. 40 years in the area. We are NACE accredited underneath Heather's federal agency. And we just serve children from 6 to the 12 years old in after-school care too. So we do the 2 centers, and then we have after-school care that we before and after school care. We also serve a CACFP program, which is the Child Care Food and Adult Program, where we go out into homes of home providers with people who are licensed for 12 or younger or less children, and we serve and we help them reimburse their food through the federal government to make sure they're serving healthy meals too. And I think right now we have about 80 providers that I see.
Wow. And what areas are those providers?
I go all the way down as far as Harrison and Parsonsfield, all the way down to York, and I go all the way up to Lincoln.
Wow. Well, it's no... There's no doubt that childcare is a challenge, especially in these hard economic times. Now, Heather, how are childcare costs and availability in Maine right now, and how have they changed over the past few years?
Yeah, so it's actually funny. I was just looking up the data the other day. Unfortunately, we're on a trajectory where we're continuing to lose childcare programs across Maine. We've seen about a 10% reduction in the last 2 years of center-based childcare and around a 7% reduction in family-based childcare. And I would note on family-based childcare, the prior couple decades before that, we were on a trajectory of a 30% decrease in family childcare. So we're continuing to see, unfortunately, that type of care decrease across the state. And so, what we don't have out there is a competitive market. It's find what you can in terms of if something is available in your local community. But then, affordability-wise, what has happened over a long time is, childcare programs try to charge what they can to let families be able to afford to attend. However, it usually is not meeting their true cost of care. And we always talk about market rates versus, cost of care, market rates, what child care programs actually charge versus the cost of care. It's what it actually would cost, per child to provide the services they do. So while child care is expensive and it is becoming affordable, even hitting our middle class families severely hard, childcare programs are not taking in enough income to cover their business expenses. I know Laura could give many examples, but typically childcare businesses operate about a 1% margin.
Wow.
Yeah.
Wow. And Laura, are those rising costs and staffing shortages affecting Family Focus's ability to keep, childcare accessible for all families?
Oh, yeah, absolutely. I mean, if you ask any of my families, the prices have gone up quite significantly in the last 5 years. And a lot of it is, we have small increases because of salaries, because we have to keep our workers, right? Which is 75 to 80% of my budget is straight up salaries and personnel costs. But what's really rising too is plow costs, right? Lawn care. I have trees, so now I have to have an arborist because I have to have trees on the playgrounds, right? They have to be trimmed and properly taken care of for safety. Cleaning. My rugs are now my building is over 20 years old. Now I've got my heaters, I think replaced I think one of the systems in one of my classrooms the motor on the roof cost me $6,000. Air conditioning, all those kind of systems all have lifetimes, and there's constant recirculation of that stuff. And now we're getting hit with a lot of the safety things. So lockdowns, right? So safety, so you have to have special doors, and you have to have, codes and all these other things that have to be rushed, and to make sure that we have our children as safe as they can be. And those are new costs that we never had before. So they're just, just small little increases that we're having in our budget, just as everyday stuff. My plowing costs are outrageous this year, but they can't get anybody either. Right. So they have to increase their fees to us. They can pay more to get the workers. So it's just this very vicious cycle.
So we're seeing rising costs, staffing shortages, not just in your businesses, but like you said, trying to find someone to plow a parking lot.
Correct.
Wow. Now, Heather, are you seeing parents reducing their work hours or leaving the workforce entirely because they can't afford the child care system?
Yeah, I mean, we can share anecdotal stories. Obviously, access to childcare is huge. I mean, I get calls all the time from people of like, do you know any place with openings? People moving into Maine even, and trying to, which is what we want. We want people to come in and seek employment and bring their families to Maine. And had an instant where actually my brother reached out to me. He's like, we have someone new at our workplace. The wife might actually move back to Florida with her children to get childcare.
Wow.
So it was, I hear these stories. I know, Aroostook County had a large center that closed, and the immediate stories that came out after that of, immediately some parents leaving the workforce, trying to rearrange work careers and schedules, and what a hardship that is to just kind of up in the middle, unfortunately when a childcare program has to close, trying to rearrange all that work, and career stuff you have to do. So it's definitely concerning. Even in our child care subsidy program, which we call the child care affordability program, that helps families who are income eligible afford to pay for child care to help with some of the access. We have families that over 1,300 families sitting on that wait list. So even, in terms of affordability and access there, we only serve, 12 to 14% of our eligible population in that program. Wow. And so we know that care is being strung together out there, or people are just not in the workforce.
And for reference, what are the qualifications to apply for that?
Yeah, so to be eligible for the child care subsidy program, you have to fall somewhere under 125% state median income.
Okay.
And then there's some priority on that wait list given to our lower income families. So if you're below 30% state median income, you would get moved off a wait list first. If you have a child with special educational needs, you'd get a priority on that wait list. Or if you are unhoused, you would get priority on that wait list. So they do try to target some really more vulnerable populations. However, we do know, in the last year, there's been families on there for over a year waiting to, who are eligible to be able to afford the child care, which also means programs are trying to help and support families, and that subsidy money is a stable income source for those programs. But unfortunately, being able to, have to just tell families, unfortunately, until the subsidy comes in, there's nothing the program can help out with.
And you said that there's about 1,300 families on that waiting list now.
Children.
So how many people can you take on, with the subsidies? Like, I know that with the 1,300 on the list, how many are you able to help?
I believe there's over 4,000 children right now being supported by that program. So there's the largest portion of that program is funded by federal funding.
Okay.
And this past year, unfortunately, the federal funding was flat funded in the federal budget, which essentially is kind of a cut because costs go up. So it's hard to balance that. But then, as a state, we do infuse around $10 million into that program to help as well.
Okay. Now, Laura, what would you say is the biggest financial challenge Family Focus faces, in providing that high quality childcare right now?
Well, a little bit of everything Heather just kind of talked about. So you have, number one is the stipends are not stable, right? So we're giving workforce stipends. So my workforce, if they take the stipends away, all of my staff get a pay cut. So they immediately make less than they were making in 2022 or whatever if they lose that stipend. I think I have a 45 infant wait list right now, just at my location. Now I know they're probably on multiple lists, so it's always kind of hard to tell how many are actually waiting. But I think the frozen subsidies, because we only have a limited amount of subsidies, has definitely impacted families being able to get back to work because you can't get to work without childcare, and you can't get childcare without a subsidy if you meet that income guideline. So we have a lot of parents who are, oh, I'm so excited, I got my job. I'm just going to call my worker and get my subsidy. And I'm like, you don't realize that the subsidy is not available, right? You're going to end up on a wait list. So then they're like, a lot of them don't know that until they've done it. We get a lot of calls from the people coming in from Maine, like she did, moving to the area. And they need care now. They're moved here now, and they have not one children, 2 children. Yeah, I'm not going to, we'll get you on the list, and we'll do our best. But so and I think that's really limits our ability to bring people in from out of state, right? And I think that really is affecting our Maine economy also. I think the other thing is that my subsidies are going down on how many families I'm serving with a subsidy. So I used to serve a good 30% or more of subsidy families, but every time we freeze it, I can't leave those openings open, so I backfill them with private pay families. So now I have very limited subsidy. I'm probably down to like only 10% of my population that uses subsidies right now, and it's not because I limited it, it's because they don't have subsidies to take a spot when they become open right now.
Wow.
So that's really, I think, challenged our families too. And the other thing is the state subsidies don't cover the true cost of care. They're below what my private pay families pay. So again, my private pay families have to make up the difference of what I'm losing in my subsidy families.
Wow.
So it's just real give and take on a lot of that stuff.
It was interesting what you had said about families moving here to Maine. I know that historically Maine is an older state. We have an aging population, and we want to see that young, vibrant, youthful population, but people won't move here if they can't get that child care. I mean, obviously jobs are a challenge to begin with, but finding that child care, that's crazy how that's impacting things.
I hate to say that I think Maine has always leaned a lot on our family child care providers. We have an amazing bunch of home family child care providers, and I don't think we're doing enough to support them. I think I started out this year with 85 in that food program that I had talked about. I'm down to 75, so 13 closed this year. And they're just retiring. They just have been doing it for a long time. I think the housing issue is causing the other end of it, where younger people can't get into the field because you got to own a house to offer home provider care, right? Yeah. And then you have to meet the certain criteria of licensing and all those kind of things. So we don't have enough younger people coming into the field that want to stay home and take care of their children and somebody else's children in a home if they can't afford the home. So it's kind of a catch-22 there.
It is, yeah.
So I guess the question really for both of you is, what specific policy changes or supports would most immediately ease the child care and economic strain on Maine families? In a perfect world, what do you think needs to happen?
I mean, in other countries where we see systems running well for early care and education, we don't think of children from ages birth through 5 differently than we think of children ages 6 up through 12th grade. We really see the care and educational infrastructure as needing to be similar, that there needs to be public investments in this birth through 5 field, because we do know in Maine, over 2/3 of Maine, children have all adults available to them in the workforce, and it probably would be higher if we had more options for childcare. So public investments are needed. Maine has taken some step forward, and I would say without the steps forward, it would probably be a lot worse than it is right now. Laura referenced the wage supplements, the stipends. So there is a monthly supplement program that does invest some state-funded dollars to help bring up the wages of childcare educators. Across the country, childcare educators are in the bottom 3% of all workforce wages. So they are some of our lowest paid people in the country, yet they are taking care of our youngest children at a time where brain development and growth is so rapid beyond any other point in their lifetime. So I think we've just undervalued this for so long and looked at it more as like babysitting than the actual professional skill set you need to provide high quality care and education to children. So public investments are needed, if we expect to have economic returns, and economists will even say if you invest in the first 5 years, your economic return for every dollar is anywhere, but depending on the economist, from $11 to $19 on return. So we wouldn't be wasting money.
No. But some reason we can't seem to invest, right? We still keep cutting it, and it's always one of the first things that gets cut is the children and the workforce that supports this field. I think it's really interesting what Heather said about the fact that you have 5 and above were in public school supported. right? Under 5, why we seem to think they don't need any of the same kind of professional supports or care that they need. They also need the food. So over 5, they all get free lunches in schools. Under 5, who's feeding them? The child care providers are feeding them, or parents are having to send in food when they're already paying for the care. So you're getting double hit on those kind of edges. And like Heather said, 80% of brain development is done by the age of 3. Mm-hmm. So when is the most important time that we should be investing the most? Is before the age of 3. By the time they get them at 5 in schools, personalities are formed, all kinds of development is formed. Good or bad, doesn't matter, and everything. But I do think that if we invest now in that public part, I do not know why we still seem to think that children under 5 anything different than over 5 and above. So I really do think, and there are, like she said, there are a lot of other countries doing a much better job of it than we are.
Yeah, it's amazing to me. I nannied for years, and those years before you hit 5, those developmental years, the milestones that they hit, and you look at a child before they start kindergarten, if they're ready for kindergarten, and so those years prior, you're taking those steps to develop skills that they're going to need, their social skills. You're teaching them colors and numbers. And again, that nutrition factor for good brain health, I mean, that boggles my mind how it's not valued. You know, we think about higher education being the most important thing. It's like, well, how do you get there?
Exactly.
And the philosophy is completely different. We're not talking about setting 2-year-olds down and giving them flashcards, right?
Yes. Yeah.
We're talking about giving them beautiful environments where they can explore and drop things and throw things and put things in their mouths and do all those things that are safe and healthy, and that we're giving them the curriculum around them to build their interests and their curiosities. Yeah. And that's what's going to then, when they become 5 or 6, going to then flourish into the school departments, right, and into the schools. So I think that early part is much more about those beautiful environments with all the things they can do, touching trees, playing in the grass, digging in the sand. All that stuff is important. I think we think it's just play, but I think if you're in the field, you know how much more there is in that. The questions we ask, the places we put our teachers for that teachable moment in the moment of that social emotional skills that they're learning, to working group care, and to wait their turns, and to be able to wash their hands and take care of them and advocate for themselves. I'm an important, valued individual, and I need something, and I need to learn how to ask for it, because as I get bigger in a bigger group, bigger schools, I need to be able to advocate for myself.
Absolutely. Yeah,
absolutely.
Definitely true. Yeah, and I would add on, in terms of, federal funding, state funding, the type of investments we can make. We have a system of early care and education through Head Start, that does have a federal investment. However, we have continued to not fund it at a level, again, when we talk about true cost of care, when we talk about the qualifications of staff in those programs and the qualifications teachers need to meet, which are often, similarly and on part of public education teachers, yet you've got people making $20,000 less a year, in these different types of settings, year round. With the, and public school teachers don't make enough. I would put that out there
Fair
too.
enough.
But you have this other industry of education that is making significantly less as well, but with similar qualifications in their higher education and credentialing. So it's it's come from a long time that just federally we have not boosted the investments where we needed to see. I think the first time we got close was just seeing an infusion during COVID to be like, all right, $50 billion to help bring this sector back up, but then it's gone. Yeah. And once it's gone, what do you see? You see that cliff happen where programs now, again, last 2 years, closing down, limiting options for families. And Laura mentioned infant toddler care is some of the hardest to find. And oh my gosh, what are we doing with our babies when you can't find care? That's really scary.
I think we're going back to latchkey kids in the school program too. Kids are going home on the bus because people aren't paying for the after school programming either. So all that stuff has become very difficult, I really think, for the middle class people. I mean, we've got subsidies to help a lot of the lower class people. People who can afford it, but I think the working families are the ones that are making those really tough decisions between high quality, expensive, care per cost of the care, in all fairness, 4-year degrees, the whole thing, and, subsidized care where you're just like literally sitting in front of a TV and, and you got to do what you got to do to get to work so you can pay the bills.
And Laura, as I was talking to you before about, if you have two working parents, one person is basically working to pay for childcare.
Yes.
So, and then it's like, all right, I'm working to pay for the childcare and I'm not seeing my child. Why am I at work? And then maybe people make the decision to stay at home. But again, it's like you have to sacrifice that career because you can't afford the childcare. I mean, where is the happy medium,
Yeah.
you know?
Right.
Yeah, and a perfect system, people have choices, right?
Mhm.
You know, we always have people who, if the family could have the choice and one of the parents could stay home, or if a grandparent's available, like, I love that people could have choices. And, you know, but for some people, when those choices aren't there, or their choice is to have a career and work, and that's great too, and we want that to happen. You know, we want high quality care to be available for them, and we want to make sure, you know, when people are going out to their jobs, that they're not sitting there worrying and wondering what's happening with their child, that they're really at a trusting and loving place, that they know they can drop off, take that breath, go to work, you know, be the employee they need to be, and then go back and pick up their child at the end of the day. And, you know, I think there's a lot of advancements we could use. You know, it's good to see some paid family medical leave systems start to happen in the state, because certainly that, you know, initial bonding and care with infants is so critical, and the fact that so many families have not had access to that, you know, that is such a health factor for families to be able to care for those kids early on. And we saw a lot of families, I think, before the program started, that you can't take infants till 6 weeks, Laura?
6 weeks.
6 weeks. But some people were going back to work in 2 weeks.
Yes.
And the child care program can't even take the baby yet. So again, what is happening with these families?
I feel like I'm going to strap
Yeah,
the baby onto me and go to work.
exactly.
Well,
We've
and they
seen
don't-
that.
Yeah, they don't have family medical leave. That's
Yeah.
a whole nother show.
Yeah.
But I think, and I think that's the challenge that I think parents are facing. So you have, and it's all fine. If you can choose to have one of you stay home, by all means, right? But as an economy in the state of Maine, what does that mean if 50% of our people start staying home who have children? Right? We don't have the workforce to even, we still need both parents in the workforce. So if one starts staying home, you know, by all means, that's, I think, our ultimate goal is to be able to make those kind of choices. But I don't think that we've set our economy up to actually support that as an economy. And I also get a lot of pushback on people who say, well, no one paid for my child care. I'm not interested in using any of our taxpayer dollars to pay for somebody else's child care. I don't want to subsidize that. But you're really helping that, you know, doctor go to work, the police officer go to work, the fire department, the teacher go to work, or the hygienist go to work. The reason why those jobs are now there's a help wanted sign in almost every place you go, because there isn't enough people, and they're like, oh, they're staying home. Nobody wants to work. I'm like, I don't necessarily think nobody wants to work. It's whether or not they can work and it makes sense to work.
Absolutely.
Yeah, and I think we saw a shift, and, you know, I think maybe a little less in Maine and more on the national level. You know, hybrid work became a thing with COVID, and some companies continued to adopt it. I think we're seeing that shift where some companies are going, no, let's bring them back in. But I'm like, the thing that hasn't been thought about is the childcare arrangements people have made around hybrid work, because that has helped some people when, you know, full day, you know, 5-day-a-week care is not available. So, you know, I think we have to recognize what is the reality of our situation where families do need to be in different workspaces, and what are solutions around that. Because, you know, just to say families figure it out, it's not working, and we're all, you know, getting hurt in these other areas. And we're also hitting families typically at the hardest times of their lives. Laura mentioned trying to afford to buy a house, you know, trying to start your career. You're not in your higher paying years yet. You're just starting to get in and trying to student loans, trying to climb the ladder. And then, you know, you're probably in your more childbearing years trying to have a child and getting hit with the childcare costs. Like, we just drown young families. And, you know, when
Such
we
a
talk
ripple
about
effect.
birth rates, like,
We did, birth rates, they can't
I
afford
knew
to
it in
have
my
children.
30s. I was like, no way could I afford a kid. Yeah.
Yeah. I think what we're finding too is more families are cutting back their work hours. I think that was something we were talked about. So again, for Maine economy to have less people working, it's just that catch-22, but they're working less to pay for less childcare, or that's all they can get. And I think that we're just not supporting them to be able to do more. I also find a lot of subsidy parents or subsidy families who are also making those hour cuts, because if they make a little bit too much, they lose their subsidies. So not encouraging them to also work more and be able to better themselves, because there's such a cliff. So once you lose, you know, make $100 more, you lose thousands in a whole bunch of other subsidies. So we're not helping that either. And if we can get them off that, then that money can be reallocated back into subsidies. So it's just moving money from one pot to another. I think we can't afford one, but if we could afford this one, then this one would slowly lessen. I think is, you know, refocusing money too in funds.
So all in all, if we invest in our child care system, we invest in our child care workers, that ripple effect, it's gonna give back to the economy as a whole. It's gonna give back to the state as a whole, like you said, allowing that doctor to go to work, allowing that firefighter to go to work. It starts with the young ones.
Yes,
you know?
does, yeah.
It really does.
And we partner with an organization called Council for Strong America, and they have, a staff person in Maine, and they did a report, kind of coming out of COVID. The Maine economy was estimated to lose around $400 million annually just on the infant toddler lack of childcare. So when you talk about
My stomach just dropped when you said that.
When you talk about economic investments and return on investment, like that's one report right there, and that's not even showing the whole picture of how much is lost.
Maine is leaving money on the table by not investing in childcare. So if we invest in childcare, our economy goes up, people go back to work, children are safe, and then children are also at a better start in school, and hopefully we'll stay in Maine and continue to prosper too. So I think a lot of that is a thing. But I think a lot of our young people are leaving the state, and I think that's another thing that we really have to address too, is why are our young people leaving the state?
There's so many programs around the state just surviving it and doing beautiful work and so committed to children and families. So I think honoring the programs that are trying so hard to stay afloat in the state of Maine, to support families.
I don't think I could say enough about that, Heather, because
Yeah.
I do think that we are investing a lot into the building of child care centers rather than the investment of the ones that are already doing it. And I think we're making some mistakes there because it's the workforce is the issue. It's not the brick and mortar of the buildings. I've got buildings that I don't even have full enrollment in because I don't have the workforce to make full enrollment. So we need to do a lot more, and that's not going to be something we can fix overnight.
Right.
That's a long-term investment with a bunch of us that need to get together and figure out how we're going to build this workforce. Then we can get our places up. And you can't build until you make sure, because all you're doing is taking a workforce from another place that then turns around and closes. So we're not increasing, we're just moving it around.
Work on what's already here instead of
Yeah.
expanding.
Support what's already here. And I think we need to get our businesses involved. So our
Yes.
businesses need to start investing into their workers, maybe start more of that FHS, I think is what it is, FSJ? Is it FHS?
Yeah, like a savings
Yes,
plan
yes.
for
Yes.
To
childcare,
help
supporting
them.
their
Yeah, so if you have young
employees.
children, let me,
Yep.
give you $100 extra a month so you can
Yep.
put it towards your childcare or whatever. So some ways of just maybe helping the businesses support and making it a new benefit that they could be offering to attract people to their
Absolutely.
workforce too, is
And-
to help with childcare.
What advice would you give to parents who are looking for childcare for their children right now?
The minute you start thinking about getting pregnant, get on every wait list you can. I mean, they call me thinking that, in 6 months. I'm like, okay, we'll call you in 2027.
I always laugh when I see in movies when someone's pregnant. They're like, "All right, we're already looking at preschools."
Yeah.
Yes.
Wait, what? You're only 6 months pregnant. Okay, there's a 5-year waiting list.
That's right.
Wow.
We're not kidding. We're not kidding.
I mean, kind of the running joke
baby, it
is
is.
that the child care program will know the family's pregnant before the rest of the family will know. Like,
And I have
it's
to
a running
say-
joke and it's serious though.
My first child, my child care knew before my husband knew.
Stop.
Because I worked in it. So I took the test there and I ran down the hall and got on the wait list and then called my husband.
That's hilarious.
So it does. It is true
Yeah.
because,
You hear it all the
do.
time.
If you,
Yeah.
And I have, every once in a while, I'll get that one parent that says, we're talking about starting a family and we'd like to come. And I'm like, oh, good for you.
Yeah.
And let me tell you, the perfect timing is you want that baby right around June and September.
If you
is when
can
the
plan that
movement
appropriately,
begins,
yes.
And then all the openings kind of juggle. That's what you're looking for.
What are the qualities that parents should be looking for in their child care facility?
Yeah.
Deciphering, okay, which one is going to work for me, which one might not,
Yeah.
And that's a fit choice. And that's a
Yeah.
really good question. And not every place has to be everything to everybody, right?
Yes.
That's the whole point, is to go out and really investigate. The state has put a few things in place for you to help you with some, and they do have questions. You can go online. They have great daycare questions to ask your local child care if you're wondering, so you can get some good places. But they also rank. We also do have a quality rating system, so you can go in and find out what the state ranks these child cares on very specific criteria that we have to follow, past licensing and above licensing. And it's a 1 through 5 step star, so you can go in there and find that. And you can ask your provider, so where are you on that?
Yeah.
That's excellent.
That
Yeah,
program,
and there is a website called childcarechoices.me.
Okay.
ME. And so you could start there if you're just like, I don't even know what's available. You could start
Any
there and
area.
say, what's in my area? You put your zip code in. It's going to spit out all the licensed childcare programs. And it will show the quality
been-
rating rank.
yes.
But, I talk to families and I say, you have to go in and visit.
with your gut.
You're going to get a gut feeling when
Yeah.
you go in. You want to see teachers down on children's levels. You want to see smiles. You want, obviously children aren't always happy. So, sometimes there's not always smiles, but you want to see that teachers are being attentive to children who need support and help, even if a child's having a rough time while you're visiting, and just ask them about their routines, their schedules, and again, it's going to be a fit for your family because you're going to want to know, what does it mean for nap time for my child?
Right.
If I'm, a mother who's
Maybe
breastfeeding, what does it
yes.
mean for feeding for my child? You want something that's going to fit for you. Again, our goal is to get to a well-funded, invested childcare system so you have those type of choices to say, this is what works for me. We have a lot of nature-based programs increasing across Maine, so getting children outside a lot. So sometimes for families, that's a great fit. Like, my child's an outdoor kid, let's get them out. Sometimes it's the nutrition focus. You have programs that are really focused on organic foods and nutrition. So if that's something that aligns with your family, I think. But going in and getting the gut feel, because I think, we do have a rating system, but don't rule out someone who's a 2
right.
or a 3 or,
Yes.
because
It's a lot of work to do, too.
It's and they're licensed, so they're going through the health and safety standards. So sometimes it's just, maybe they're not offering that parent-teacher conference that might be on that next level, but they're constantly talking to you in other ways. So I just say, go in and get the feel.
Don't be scared by the
Especially the home
scared of
providers,
them.
they're already working 60 hours a week, so the extras that
Yeah.
they have to do and stuff. And in those home providers, there you're looking at lower ratios, right? You're looking at a smaller group size. So that has a lot to do with your child and knowing your child and what your child will do best in. Is maybe your child needs a smaller group size and that little bit more hominess, which is just, just a fabulous program. There are some fabulous home providers on top of our center-based care. But the home providers are out there working so hard with so many hours with very minimal supports from anybody. And they are actually eating the costs of their food and their stuff because they refuse to pass it on to their parents.
Right.
So a lot of them are doing a lot, and they're taking money out of their own pockets to do some of that stuff.
Which is great because families should visit all types of settings.
They
too,
should.
'cause you might have it in your head, I want center-based. You might have it in your head,
Home-based,
I want this. But then you go visit somewhere and you go, you know what, this is what my child needs. So I would recommend just making the time to
You have
visit.
to walk in and just feel what you feel like. This feels like
Yep.
Yeah. It's a partnership, so you got to make sure that it's a good partner.
Trust is huge. Actually, I want to tell a funny story because we had a keynote speaker at our conference this year, and she was telling a story about how one thing she would do when she was running her own childcare center was at the end of the tour, and the parents are like, yes, I want to sign up. I love this place. She would say to them, okay, here's some paperwork, and give me a copy of your car key and your house key. And she's like, some families would throw it over, no second guess. Other families would look and be like, wait a minute, this is weird. Why would I let you have my house key? Like, you're going to send your child to me every day and you wouldn't trust me with your house key? So it really is this trust feeling that you want to have with your providers and open communication. And providers can be such great partners too. Educators can be such great partners with some of that developmental stuff that as new parents you're going, I don't know what this phase means for my child. Let's partner together and work on it together. So it's, it is such a fit and feel.
And it's a very difficult business. Like Heather mentioned earlier, what a 1% margin of error on your budgets and things like that. And I think that we devalue it so much to the point that with a 4-year degree, we want you making what you could make flipping hamburgers or picking up the trash at the side of the road, or probably even less than that because they get benefits and pensions. But I think that it just gets very tricky for us to think of what we want for our children and then not understand how it pays for it. We are such a ratio-driven field. We can't just close down an aisle. We can't just close early, right? We have children, and we have to have a teacher in their baby room, 2 teachers for every, 8 babies, so 4 to 1, 5 to 1. So these ratios are what drive the personnel costs so high to 80% of your budget. So because of that, that is why so many other businesses, when you do well, it's because you have low overhead and personnel costs, and we just can't control our personnel costs.
And important ratios because
ratios.
You want
don't mess with those,
children
please.
Please
you want not get a good idea and think that if we just increase the ratios, we will fix the problem.
That's been a policy solution
Yes, it
proposed
has,
sometimes, but
I understand sitting at a desk why you would think that. I mean, the numbers. Sure, well, we'll just,
just add some
have a
more-
couple more babies.
Just
in there,
add some
right?
more kids,
My
yeah.
teachers would walk out on me if I
Yeah.
added a couple more babies into their ratios to take care of. So yeah.
Yeah, because I think one thing people
One
forget
teacher with
is
4 babies. Think about that.
teachers are the nurses in the school. They are when you have allergies, you're the ones attending to the allergies. You're the behavioral therapist. childcare programs aren't equipped with all these additional maybe specialist type of staff, special education needs, there's also, some challenges there in trying to support children in childcare programs with special educational needs. And so, there's not enough support offered to these programs to do the things we ask them to do.
I invite anybody who does to come on into my toddler room and get 10 toddlers in their snowsuits and in all their gear and out the door. It is an Olympic event.
And you'll be timed.
And as quick as you get 5 of them done, they start undressing. I have to go to the bath, and then you're still trying to get the rest of them in and out the door. It's an Olympic event. It's such a vicious cycle in the baby room. Come on in and take
the outdoor elements. It's like we have to put them in snowsuits and mittens.
The mittens.
They pull them off.
They can't
The straight hands of.
They just
Where do I go?
walk. And the babies too. The babies gotta go out there and we just drop them in a snowbank. So get some
Enjoy the weather.
Get some vitamin D. But
Heather.
it is very tricky. But I always talk about the representatives. Come on down before
Yeah,
you start
please
moving
visit.
ratios and
Exactly.
and toddlers out the door. But we do a birthday party. If you have like 3-year-olds and you have a 3-year-old, you invite 6, 7 of their little friends over, and the parents leave you for 2 hours, and you're exhausted at the end of the 2 hours. Think of that all day long.
All day long.
Every single 5 days a week, right? So think about those ratios when you do it, right? Parents, do you want me to leave? No, we don't. Stay right here. Stay here for the birthday party. Don't go.
Heather, Laura, thank you so
you.
much
Yeah.
for
Thank
coming in
you.
to talk to us. I appreciate your wisdom, your knowledge, and everything that you do day in and day out.
We appreciate that. We
Yeah.
do.